This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. Today's episode is going to be a little bit different in that, number one, you're just going to hear me talk, which I typically don't like doing. I like interviewing people because I always learn things from them, and I've been very fortunate over the years of doing this that I have had some tremendous guests on my show. So it's just going to be me talking. But number two, I'm going to open up myself a little bit and just let you know about been going on in my life, which has been a lot. I will just start by saying that sometimes life happens. Some things have happened in my life in the last year that forced me to go a different path. And so I had to make a decision about going forward professionally. And so I have left my current clinic, and I'm not going to get into those reasons. You can probably read between the lines, but I'm not going to get into that. So with me leaving that clinic, I had to decide what I was going to do. I thought, at least for a minute, about going back to corporate medicine, although at the end of the day, thought I just can't do that. I don't believe in that style of practice anymore. The constraints of that type of medicine, to be forced to most likely take certain vaccines that I don't want to take and whatever. So what I decided to do was to keep doing what I love to do and practice medicine in the way that I like to practice by opening my own clinic. And so actually this week I have opened my own clinic, and wouldn't you know it, the name is FitRx, and I just added a health and wellness to it. So FitRx Health and Wellness is my new clinic, and it is still in Tuttle, Oklahoma, which is where the other clinic was. I just want to talk about that clinic for a minute. So number one, it's a direct primary care clinic. I have talked about direct primary care on here before, but you have to go way back where I just kind of devoted an episode to that. So I just wanted to talk about direct primary care for those who may not be as familiar with it. I mean, if you're a current patient of mine, obviously you are familiar with it, but a lot of people who listen to this show aren't my patients. So direct primary care is a style of practice where people pay a monthly membership fee, so we don't take insurance, and that membership fee gives them direct access to their doctor. And so it's almost like going back in time to where you paid your doctor for their services. So you don't have all the middle people. So you're not constrained by practicing a certain way because of insurance companies and documenting, X, Y, and Z so that you can get paid. So you take out all the middle people, and it's just a direct relationship with your doctor. Most direct primary care physicians are on call 24/7. You have access to that, and you can text your doctor on weekends. If you a rash, poison ivy, whatever, you take a picture, you can text your doctor, and they'll get back to you. Also, with that, because we do a lot of cash-based services, we have made deals with other vendors like labs and imaging and stuff like that. And what we've learned is that if you take out all the middle people, things really aren't that expensive, in the big picture, especially compared to what people are used to paying or what insurance pays. And so, for example, we can get labs done at 80% less than what's billed by insurance. We can get imaging for a lot of times cheaper than even what people's copays are. And so, and then we also work on the patient's behalf, especially if they're paying cash, to just make sure they get the best deal. And so that's direct primary care in a nutshell. It is It is slow, but it is catching on more and more because doctors are getting frustrated just being in the corporate medicine system, and they're looking for something different, and they want to get back to the doctor-patient relationship. And this does that. Now, there are still a lot of direct primary care physicians who I would call, quote, conventional, meaning that, they just throw pills at you and whatever. They're just doing it in a different system than corporate. But it is a good answer to those physicians who are just frustrated with the bureaucracy of, traditional medicine. So at the core, my clinic, FitRx Health and Wellness, is a direct primary care clinic. And so we see people of all ages, babies to elderly, and, treat primary care. Now, where I differ from the more, quote, traditional is that I'm very wellness minded, as I'm sure you know that if you listen to this podcast. And I really try to get to the root problem rather than just throwing pills at people. We do that obviously through diet, through exercise, through weight loss, through hormone optimization, and with the goal being, if people are on a bunch of medications and we can get them well, then hopefully we can get them off medications and really optimize health. And that's always the goal, and that should be the goal with general health care, but unfortunately in regular health care it's not. You've heard me talk about the sick cycle of medicine, and that's what I feel like a lot of people are in, especially when they're in traditional medicine, is they just keep cycling. They're going from specialist to specialist, being put on medication after medication, and at the end of the day they don't feel any better. Now they're up on all this medication. And so when I get people in that have been in that system, we really try to just hit the reset button, hopefully eventually get them off medications. And so that's just the way that I like to practice. And I mentioned hormone optimization. You've heard me talk about hormones on here before, and so I'm not going to belabor that. But I am a big believer for men and women of middle age, to optimize hormones. And we see a lot of women in perimenopause and menopause, and then obviously middle-aged men who are in what we call andropause, which is where the testosterone gets low. And I feel by optimizing those hormones, then it can really help in all these other areas. And so I feel like we're definitely kind of specialists in that area. And within the hormone replacement area, we do for both men and women shots, although that's usually for just men, but we can do shots for women. We do compounded creams, or we can also do hormone pellets, which again, I've had episodes about that in the past, so I'm not going to go into detail about each one of those. On top of that, at our clinic, I'm also going to continue doing ozone therapy. If you want to learn more about ozone, specifically intravenous ozone, I would refer back to, I believe I called it the Ozone Miracle, but it's where I interviewed Dr. Frank Schallenberger, who is really he's one of the world-renowned experts in ozone therapy. And so we talk a lot, about the ins and outs of ozone. And so, but ozone is something I believe in. I mean, I've seen tremendous results and just testimonials in the last year and a half or so since I've been doing ozone therapy of pain relief, a reversal of long-haul COVID, reversal of chronic viral type syndromes. And so just got a number of uses. And so that was definitely something I wanted to continue in the new clinic. And then lastly, we're doing some IV nutrition. That's something that can make people feel better. I usually describe it as you're filling up the gas tank. And so especially if you've been kind of down, kind of low energy, come in, we do something called Myers Cocktail, which has a little bit of everything in it as far as vitamins and minerals. And then I will also continue to do the high-dose IV vitamin C that we have done in the past that has a lot of uses as far as immunity in cancer treatment and different things. So excited to just continue all these treatments and do the kind of medicine that I like to do. And so it's also exciting to have my very own clinic. And so if you want to learn more, you can go to my website, which is fitrxwellnessok.com. List all of our services and has our contact information and stuff like that. So that's about it. So short episode. I really am releasing this episode because there's a lot of confusion about me leaving the last clinic. And so I know I do have some patients who listen to my podcast, and I just wanted at least to briefly explain the circumstances. And I also wanted you to know that I'm still going to be practicing this style of medicine. Just, find me on the website, and appreciate everyone listening, and certainly those that see me here locally that will continue to see me and trust me, with their healthcare needs. I will be releasing a more regular episode here coming up, so just be looking for that, and appreciate everyone listening to this short little segment, and we will talk to you later. Thanks. Bye. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.